The tick research team puts on white protective coveralls before going into the field. The miniature dark-colored insects show up better on a light background. Researchers can better spot them and remove the tiny insects for investigation. In the field, researchers drag a white sheet-like cloth through the woods, gathering ticks that attach themselves to the moving sheet.
We go out into the field in appropriate tick habitat, and we take white cloths known as drag cloths and cover 1,000 square meters of the forest floor, and that's how we survey for ticks. The ticks that we find, we collect and test them for the various pathogens. The ticks don't really jump onto the white cloth. The ticks are host-seeking, so they are going about this behavior where they're trying to find a host, a small mammal, bird, deer, to feed on. And so they climb up on the foliage and they put out their arms, and when a mammal, a bird, or our drag cloth goes by, or a person, they'll stick. And so they don't jump, they just attach. And it allows us to collect enough for testing.
Tick activity begins in May. Ticks wait in low-lying vegetation like this for a host to come along. It could be a small mammal or a bird, and they latch onto them, gorging blood for 4 or 5 days and swelling to many times their original size. Sporn and her group have been working with the New York State Department of Health for the last couple of years, documenting the increase of ticks. The team collects the black-legged insects, also called deer ticks. The research at Paul Smith College has been going on for 4 years. The Department of Health in Albany does all the pathogen testing there. Sporn said that there is little money available for Lyme disease testing. They are seeking enough money to support the 2018 season to continue their research. The work helps to protect the public from serious illness or even death. Some preliminary testing is done in their laboratory.
We test for 5 pathogens that are known to affect humans. The most common here in the North Country and in New York State is Lyme disease, which of course can have very serious effects on human health. We also test for a malaria-like parasite, which we recently found in the North Country for the first time last summer, called Babesia microti, which causes a malaria-like illness that can be very serious. We test also for Powassan virus, also known as deer tick virus, which can be fatal in a certain number of cases. I think around 10% of cases it's actually fatal. It causes an encephalitis. And there's recently been reports of 3 cases in Saratoga County.
Tick research is being done in 6 upstate counties, covering virtually all of the North Country where ticks are becoming more abundant.
We work directly with the Department of Health in Albany, and we enhance their efforts to do enhanced surveillance here in the North Country where ticks are becoming more abundant and where these diseases are emerging.
The work that Sporn's team and the State Department of Health is conducting is disseminated to various counties in the state so they can be brought up to speed on the seriousness of Lyme disease. It is felt that Lyme disease exists throughout the North Country and that the public should be aware of ticks and to check their clothing and body after outdoor activity. It takes only minutes to do that and could mean a lot for your health. For Mountain Lake Journal, I'm Jack LaDuke at Paul Smith College.